For once, I'm here at 6 o'clock, so let's do this. Okay, I'm going to call the meeting to order. I don't believe we have any new introductions around the table. So we will move right on to privilege of the floor, and we have a couple guests with us tonight. Hannah's going to give you instructions about how privilege of the floor works and how much time you have to speak with us as the board, and then we'll move on with our agenda.
So for individuals, you'll have 3 minutes to address the board. And then if Dr. Kidder would like to respond tonight, she may. If not, there will be a drafted formal response returned to you after the meeting. So whenever you want to get started.
So let's start with Marcia.
Oh, thank you for the privilege of the floor. My name is Marcia Clark, and I had prepared a document I think each of you have in your packet, so that's what I will be addressing, but I don't know who's the timekeeper here, you?
Hey.
Okay. So let me know when I'm.
Oh, yeah.
Yeah. So my topic tonight is the vaccine preventable disease measles. And there's a cover letter. I won't bother to go through that because it takes up too much time. But basically, I've been following the measles outbreak in Texas that is growing, has gone to 3 states. It began with the under-immunized rural population and has now had 2 deaths, an unvaccinated child and unvaccinated an adult, over 29 hospitalizations. And recently a lady delivered in one of the hospitals in that area and did not know she had measles, and it was detected afterwards, which is a nightmare for the maternity and labor and babies that are only a day or 2 old. So I thought I better look to see what our risk assessment is. And I looked at the community health assessment plan and improvement plan of 192 pages to look for how much is there for Chautauqua County on vaccine preventable diseases. And there was only 6 pages. And of that, 5, understandably, was related to COVID, since what everybody's been going through for the last 5 years. So I thought we better take a deeper dive into what is our risk. And basically that's this sheet for you all. It describes our NICE system, which all our providers in the county use and in New York State. And as of January 1st, 25, the MMR, the children who received 1 dose of MMR, ages 24 to 35 months of age, before their 2nd birthday, their level was 83.7. And this is of children whose parents want to have their kids vaccinated. And that's 83.7. I talked a little bit about the NICE system. It's a system that all users use. It's a way for them to determine what vaccinations are needed for children and what their coverage is within their practices. But also that the NICE user manual has a lot of tools that providers can use to really assess what the coverage is within their practice, and that those tools can be used and is available to them in PDF data. So I'm encouraging our health department to contact the providers that provide immunizations. And if they need some help in how to use these tools, let's give them that information, because that can raise that from 83.7 even higher. However, to rely only on the NICE system to determine what the immunization rates is misleading. Children who are in New York State who have never received a vaccination aren't in the NICE system. So yes, so right there, you've got some problems. So I thought I'd better look at the New York State School Immunization Survey. So what I did was copy that out from the New York State Health Department, only included the private schools for you. There's 25 private schools, 4 of those great immunizations, 95%, just like our public schools. So that's not why they're included in your packet. But the remaining 21 schools are Amish schools, and they have measles vaccine percentages ranging, from 0 to 76. And those levels are levels that can really fuel an outbreak. Also, another factor is homeschooling. There is an increased trend for homeschooling in our county and in the nation. Reasons are varied, and there's lots of reasons. But one of them, I know private practices are aware of, who provide immunizations to children, is that parents are refusing to get their children vaccinated against the vaccine preventable diseases. So they homeschool. So we have no way to determine how many of those homeschooled kids are vaccinated or not. But we do know that all our 18 school districts have children homeschooled in them. And as they have 22 to 23, and this is based on the New York State Department of Education Fed's report, there are 651 students being homeschooled. So I just want to stress that these under-vaccinated groups within our county are not insular. They're very mobile, and they could easily support a widespread measles outbreak. In the past, the Chautauqua County Health Department did offer immunization clinics to areas in which there were under-immunized children, and in Clymer and Sherman. Both those clinics were attended by families whose children were under-vaccinated because it was accessible to them, and they could get there with a bunch of kids. Those have been ended, and I think it's a good time to look at resumption of those clinics. And in conclusion, experts worry that when immunization rates fall and an outbreak occurs within a disease that is vaccine preventable, other vaccine preventable disease outbreaks will follow. And in your packet, I have mentioned that in 1991, Chautauqua County had an outbreak of measles that had 99 confirmed cases. The year that followed, 1992, we had an outbreak of rubella. And rubella is a fairly mild illness, but however, before the rubella vaccine was available, it was the leading cause of health defects in babies in the nation. So this news is very sobering. It's since that time, since 1991, the number of our unimmunized population in our county has increased dramatically. And I do really think we are ripe for an outbreak, and it's the Board of Health's responsibility to provide directives to the health department to try to figure out some ways that we can look for multi-pronged, comprehensive plans to address this. And that's it. How'd I do?
Not too bad, not too bad. You're good, yeah. You were close. Let's let you finish up because you're wrapping it up, so.
Okay.
Yeah.
So, yeah, thank you. Thank you for the privilege of the floor. I appreciate it. Thank you very much. Happy birthday.
Right, thank you.
Sorry, I got my back to somebody no matter where I sit.
Yeah.
Okay, you're good. Okay, Jean Palmer. Sure. Is that you, Jean?
Yes.
Okay, would you like to address us?
Yes, first of all, I'd like to apologize that I'm not here on a positive note. But you all need to hear this, what I've experienced over the last couple of years. And when I called about coming to the meeting, they asked the reason, and I told them I said, because I cannot receive health care anymore. There's a difference between can't and not wanting to. Okay, it started like 6 years ago. And my provider, I went to my provider, they sent me to Westfield Hospital. My leg was swelled up so much, I couldn't put pants on. I had to wear shorts. I couldn't wear a shoe or sock. They might probably got a blood clot. So they call Westfield Hospital, tell me to go right down. I go down there, tell the lady at the admissions desk that my doctor just called down here to expect me. They want me to have a Doppler. I'm sorry, we only do Dopplers by appointment. I'm like, okay, I thought I explained that pretty well. I repeat myself. I said, they're expecting me. My doctor just called down. He wheels the chair around, talks to somebody else, must have a confidential impediment. Went back around. I said, I'm sorry, sir. You're going to have to come back. I'm not even wearing a shoe or a sock. I start recording the woman. I hobble my way out to my vehicle. I call my provider's office, Family Health Medical Services in Mayville. They're on lunch with no option of leaving a message. As I'm pulling into my driveway, coming back and being turned away at the hospital, Catherine Moline calls. I'm in my vehicle, which has a dash cam with audio and video. That was really handy. She called to demand why I didn't go to the hospital. Like, why? I said, I went to the hospital. I said, they turned me away and refused to see me. Well, I just got off the phone with them. They said you were never there. I'm like, they're lying. And I used an expletive after that. I said, they're lying. I said, they refused to see me and turned me away. Why would I not go to the hospital? I was in so much pain, I can't even put regular clothes on. I'm sorry, but we have to go by what they say unless I have to go in your record. I'm like, I said, I can go somewhere else, right? She's like, well, yeah. I said, good, I'm going somewhere else. And I hang up on her. I call up Excelsior Orthopedics. They get me in the next day. File a complaint with the hospital. Now this takes balls. They write me back. At the time, it was Edward Brooks, the director of operations. He's just writing what people tell him. He has no clue of anything. I was taken back to an exam room that day. They were having equipment problems. The tech explained to me that they were having equipment problems, and that's why they couldn't do the test. I'm like, wow. I got video of me being turned away. And also my dash cam in my vehicle. It shut off at the time I got there. I turned back on at the time when I turned my vehicle on to leave the hospital. They're telling me I was taken back to an exam, falsified everything that happened. Everything, start to finish. Okay. So I'm like, let's see how that works. I can see how good I can play this game. New York State Hospital Patient Bill of Rights. You have the right to know the names of the people involved in your care, right? I put in a written request for the names of the tech that took me back to the exam room, the name of the admissions lady that turned me away. Want to know what their response was? Piss off. We ain't giving you any names. A month later, I make an appointment back at Family Health Medical Services, Catherine Moline. I got the letter from the hospital stating I went there that day. I play the recording for her of me telling her I went to the hospital. Demanding to know why she would put in there. She puts in my non-compliant letter. When I spoke to you on the phone, you acknowledged to me you didn't go to the hospital. Straight up lie and falsified everything I said. And the non-compliant letter I got was from Dr. Burke. So I tell her, I said, well, here, you tell Dr. Burke, you take that non-compliant letter and shove it. I wrote on there everything that had transpired, told her to give that to Dr. Burke. Month goes by, and I really think I would have heard something. Discharged, something. It's been about a month. I make another appointment, Dr. Riedesel. Same thing. I give him the same papers, tell him what happened, everything. Give this to Dr. Burke. But a month goes by, I'm like, nothing, not a damn thing. I make a third appointment. I ask to speak to the office manager before I see Catherine Moline. She comes out. I'm telling her everything that's transpired. I said I gave all kinds of letters, Catherine Moline and Dr. Riedesel to be delivered to Dr. Burke. I can't believe I haven't heard anything discharged because I used some pretty strong language. If you're falsifying my records, I guess you can serve a couple of bits of profanity. Nothing. She's like, oh, I'm sure they gave Dr. Burke. Dr. Burke's response to me, when the manager finally gives them to her, I read the letters you left in my office on such and such a date, and we can't, that's a violating doctor-patient relationship. You violated the doctor-patient relationship and falsified my records.
Gene, we are well over 3 minutes, so we're going to give you a minute to wrap up. Though.
Yeah, I've had this go on at 2 other practices. I have them on tape falsifying my records, a cardiologist. They send me out a Holter monitor to wear. A couple weeks goes by, they call me up, want to know if I'm wearing it. Like, no, I said, I never received it. They put in my record that I refused to wear it, mailed it back. They ordered, this is a cardiologist, I've had open heart surgery. They order a CTA scan for me. Multiple calls to their office to get blood work done. Can't, not happening. They won't do the CTA scan unless you have blood work done. This is just a word of mouth. I put in there, I asked them, they said, oh, no, you were no call. They put in my record, I was a no call, no show for the CTA. So now I'm non-compliant with the Holter monitor, non-compliant with that. I go to one of their offices, have them listen to the tapes of me telling them, calling for blood work and everything, calling Brooks Hospital. They're like, no, we won't go without blood work. And one of their managers listening to it, they're like, okay, we'll forward this to the proper department. It had been 6 months. I gave up on the order for blood work. Within 48 hours, I get a non-compliant letter in the mail being discharged for being non-compliant to treatment recommendations. Last doctor I went to, if I may just finish this last little story. I mean, this is horrific, okay? In Luanda, wherever their practice is called. On my initial appointment, I tell the nurse, I said, I've been traumatized because there's been other things. I wrote dozens of letters to Westfield, Allegheny Health, telling them that you falsified everything. I was never in no exam room. I was booted out the front door. They refused to change anything. I've been telling her this. I have her listen to some of the conversations of me telling Catherine Lean. I went to the hospital and they turned me away. And I told her, I said, I have been traumatized. I mean, if you go, nobody knows what PTSD is until you had it. Trust me, I've been there, done that. I've never understood, don't understand the depth of it. I'm in there talking to Laura Lee, telling her on my initial appointment. And all of a sudden she's listening to me, I'm telling her some horrific things. These are documented. These are not he said, she said. All of a sudden something catches her eye. She looks,
Thank you so much for your time. We're at 7 minutes now, so we do need to move on with the rest of the agenda. The notes will be recorded and you will get a formal response, okay? In any way that we can help refer and provide information.
well, I was just gonna say that I was on the exam table and something catches Laura Lee's eye and she looks down, water dripping off the exam table. I'm on an exam table, just down in a cool room. Water had completely saturated the paper that I'm sitting on. It was now dripping onto the floor. Want to know what my blood pressure was? If you need copies of any of the claims and stuff that I've made,
We will certainly reach out.
Okay.
Thank you, Jean,
Yeah.
for coming and sharing.
Thank you. Any other?
That is all.
Yes.
it's kind of cool.
Okay, thank you to our participants and privilege of the floor for coming. We will move on now to the approval of the minutes from our January meeting. I believe we all have them in front of us. Everyone wants to take a glance at those, and when you've had a chance, if there's a motion to approve them.
Move to approve.
Any seconds?
I'll second.
Okay. All right. New business. We're going to jump right into agreements to settle tonight.
So if you remember from last meeting, I didn't have any for you and I told you more would be coming. So here's your list. So these are agreements to settle that there was a Board of Health hearing on January 29th. So these notices of violation had gone out prior to that hearing, but because of the timing of the hearing and when we got everything out, you know, folks hadn't had enough time to respond to those agreements to settle. By the time we got that hearing date and our Board of Health meeting date. So this is your list from the violations that were issued to come to the hearing on January 29th. As you can see, unfortunately, the large majority are related to public water supplies. And, you know, for the various sorts of problems that we have, lack of appropriate biological sampling, lack of monthly operation reports, you know, unfortunately, just sort of more of the same. So we've got, have organized them with the individuals who have a single violation listed per violation. And then some of the public water supplies have multiple violations. And so I've listed those subsequent to the single violations. And then we do have some tobacco enforcement updates. If you'd like to discuss any of the water things, I can answer those questions now. Otherwise, I'll move right into the tobacco enforcement case that we had. So this Bridgeview tobacco enforcement case, they sold to an individual under the age of 21. This situation, they did eventually sign an agreement to settle. They actually did come to the hearing. The attorney, or the county attorney at the time, offered them the agreement to settle when they arrived at the hearing. which I have discussed with our attorneys moving forward, is not something that we're going to do. If we make it to a hearing date, they're going to be heard at a hearing. We're not going to be signing agreements to settle on the day of hearings anymore. Because it has wasted time and effort, and there's not an opportunity for us to reconsider the costs and the violations and the fines that have gone along with those cases. So this is that Bridgeview case. And then just as a general sort of update on where we are with some of our different tobacco enforcement program situations, the Fredonia Food Mart, downtown Fredonia on Temple Street, they did actually, so we did find them selling products while their license was suspended. So the New York State Department of Tax and Finance did issue a revocation of their license, and that was effective March 17th. So they should not be selling anything. That operator at that location should not be selling anything again, tobacco product related. And then the following three establishments, Clouds in Lakewood, the NF Ozone in Fredonia, and Dunkirk Express, they're all currently under suspended licenses for a year. So they should not be selling anything either. Just for some sort of general information about, to give you an idea about the difficulties that we have with this program and the enforcement of it. The NF Ozone in particular, we did follow up on their license suspension and found that there is product in that facility still, but they have changed the operator name of that facility. So they are still selling product. We have reached out to our state representatives to assess the transfer of that license, because you're concerned that it's an arm's length transfer that may actually be an additional violation of what you're allowed to do with your tobacco license. So we're waiting for that response from state.
But they are allowed to transfer a license when there's a suspension to the
So
license?
A license can be transferred, but it has to be more than that arm's length sale. So in this particular circumstance, we suspect that the license was transferred to a relative, which is not allowed. So we are elevating that to our state folks to make sure that we understand the compliance, and we're, sharing the evidence that we have gathered and the statements that we have heard from clerks and folks, and following up.
It's this email here that was just sent to us. Would that be
That's next.
All right,
Yeah.
I just wanted to make sure I was getting the right.
Yeah, don't worry.
Yeah.
Are there routine drop-ins at the suspended facilities?
So when a license gets suspended, we are required to follow up on that suspension within 2 months or 3 months. I can't remember which one it is. So that was the case with this Ozone, is that we were following up on that license suspension because their license was just suspended in January. So we were following up on that suspension when we identified product and had a conversation with the clerk and have reason to suspect they've done something.
I have a really naive question. What do they sell at Clouds besides tobacco products?
Glassware and
Songs.
other accessories.
Okay, so they're able to stay in business.
They
by just
are
selling
also under suspension, and we have done our investigation, and you will likely hear a case regarding that situation at the next meeting.
So technically, they shouldn't have any vapes in the building at all. Of course, they've been selling the illegal ones openly, but they shouldn't have any.
Correct.
So if somebody goes in and buys one, obviously they're violating the suspension.
Correct.
By a ball, yes, right, a glass ball.
Glassware.
I'm just saying.
Yes.
Yeah,
So
they're one of my favorites.
So we'll work through the process. Like I said, we're anticipating to either see them or not see them at the next Board of Health hearing. And then that case will then be presented to you, and depending on the outcome of that case and your decisions, we would be potentially moving that case forward to a license revocation recommendation as well.
And they have more than one outlet there. They have multiple.
It'd be interesting to understand what passes muster for more than an arm's length transfer of license.
Yeah, that's, like I said, that's information. This is the first time
And
that
that
we're
you've had this,
experiencing
yeah.
this.
Mhm.
So this is providing a learning opportunity for us, to understand moving forward.
Where the loopholes are and these.
Yeah.
They've certainly figured it.
Well, that's the problem, is they tend to be a little ahead of us on some of these things, and I have to follow the written regulations, and we're creating new workarounds before the written regulations get through all of the different.
Yeah.
So, any questions, any more? So then you want me to just launch into facts and
Just-
findings?
yep.
Okay.
Keep going to hearing officer recommendations.
So still not yet. So this first, the first hearing officer facts and findings, this is regarding another tobacco retailer in Fredonia called Fredonia Convenience, who honestly, the facility is no longer there. They kind of opened for a hot minute, and since then that facility has closed, and it's now being turned into a restaurant. So, however, they were found selling tobacco, flavored vapes, at the facility when we did our inspection. So we documented the violation, submitted it, notified the facility operator. They, declined to come to hearing, so we held it without them, and the hearing officer recommended that they were found in violation of having 10 flavored vape products. So the fine level would be $1,500 for the violation of having the illegal flavored vape product, and then $100 per pack of flavored vape product that we identified, and we identified 10 packs. So that gets us to $2,500 plus the required surcharge of that $250, which is required for all violations of the Atuba Tobacco Enforcement Program. So that's the recommendation of the hearing officer.
And these points carry with this individual if they were to try to open another place of business?
If it's in a different location, no.
Is the owner still in?
We haven't confirmed it because we don't always get to interact with the actual owners. We're frequently only dealing with the clerks who tell us they don't know anything about who owns the business. But based on the name and sort of the appearance of the storefront, we do suspect that these folks have other businesses in the county.
I mean, they have their business license or something.
Yeah, but the LLC is named slightly different for the different locations. Yeah,
There's a few major players that
yeah,
have a bunch of.
yeah.
If they fail to pay, there's not much we can do because they're out of business. There's no. Of course, yeah.
Mhm. But it's still good for us to document
Yeah.
the violation. And, I would certainly need your folks to vote on it to be able to document it.
And there's some proactive things we can do. We'll talk later about.
Are there any further questions or edits? Or if not, is there a motion to approve the hearing officer recommendations as written?
So
Okay, we got Dr. Khan. Is there a second?
I'll second.
Dr. Pender, thank you. Okay. What else you got?
The next one is related to a public water supply. This is a business in Portland, Old Chautauqua Vineyards in Portland. So there's a number of violations that they were cited for. We sent the notice of violation and notice of hearing. We received no response. We did actually, try to follow up with this individual with multiple phone calls and voicemails to try to remind them of the hearing date on January 29th. But we received no response. So the hearing was held without them present. The hearing officer found them in violation of the 4 items that we've listed in the document. The fees and fines that were implemented in this document are based on the 2024 numbers, not those new numbers that you folks voted on at the January hearing or at the January meeting. So that's where that $400 comes from for the 4 different fines. If they had been issued the fines under the new fine schedule, it would be a total of $800 would have been offered for the agreement to settle. Currently, they are up to date on their recommendations for the 2025 calendar year. In the 2024 calendar year, in addition to the 2 monthly operation reports that were listed in the notice of violation, they also missed 2 others. So total 24, they missed 4 monthly reports, 2 bacteria samples, and a nitrate sample. So they have been on your agreement to settle lists in prior meetings for 2024.
I was going to ask you, have you heard this name before? So, as you confirmed. Is this letter relevant
Yes,
to
we got
this
that this
case?
afternoon.
Correct, yeah. So so the email printout that you have is one of the operators of this system.
This is 21 Dix.
Correct.
I think the email recognition is nice, seeing that we don't probably ever get that. It just doesn't quite add up with all of the things. Like the hearings that was missed. It doesn't, I don't think it's a full excuse. I think it's nice to acknowledge it, but I don't think it's an excuse.
Because you can always designate someone else to come attend and, I think they get reading the wrong pile and I'm pretty hearing notice in the pile. I don't.
You attend all your hearings.
Any further comments? Edits to, how do we feel about the proposed, total fine? There is no 250 that's.
No, the
included in
250 is specifically for the tobacco facility violation, and
right.
that's set with the New York State Department of Health code that we have to follow.
You probably remind us of that every meeting, but I'll just.
You don't live in my world all the time. It's all right. I understand.
Close out the last vote.
Oh.
Yeah, we just, that's what they believe.
Oh, we didn't, I'm
it's still
sorry.
Open.
Okay,
We can just vote on it.
let's back up to the first one. Sorry about that. So we had a motion, we had a second. All in favor of the motion? Any opposed? All right. Thank you very much.
Great.
We got that one closed out. Okay. Now we're moving on to we're in discussion of the Old Chautauqua Vineyards and the current proposed fine of $400.
What did you say the fine could be now?
800 if it were according to the new schedule we voted on in January.
But all these occurrences happened.
Previous to that in 2024.
I'll motion $400.
Accepted as written. There a second?
I'll second.
Don second. All in favor of that motion? Any opposed?
Having been by that place many times on the bicycle, it's always very busy. I don't think the 400. Yeah, no. Measure.
We'll see how 2025 goes.
We have been, so, I mean, I think I've mentioned to all of the newer faces in the room, but we do send out annual packets to all of these different folks with sampling schedules. Because each of these different sort of facilities are different sizes, different water quality concerns. So we have sent out new packets for those different facilities, and we have definitely given everybody a heads up that the fines are higher.
You know, to add to this, this actually came up in a state association call, as I had just emailed you about this the other day. It is not standard practice nor required that we provide as much communication as we do with these compliance schedules. So this is something that Jessica's staff goes above and beyond to really support the local businesses to ensure that they have information. Because, our point is really to be a support. We don't want people in violation,
Very much
we
not.
want people in compliance, providing clean public water supply. And so that was something that I thought was worth, providing a little bit of information for you all that, other counties are not providing this level of information.
Yeah, thank you, Jessica.
You're
welcome.
Jessica, before we hop off of your area, do you want
Sure.
to talk about Ron?
Sure.
Talk about him?
We wrapped up the vote, right? We're good with it?
We're good.
Yes, okay.
Motion carried. So since we're talking about public water supplies, I brought a friend with me today. So Ron Wasik over here in the corner, Junior, sorry. I think you folks may have remembered, I sort of hemmed and hawed at great length about the importance of a professional engineer on staff with the county health department. So Ron joined us in October as an assistant public health engineer. So he has been with us since October, and we've been trying to teach him the ropes, thrown him into some of the code books, made the connections. And now that the weather's breaking, we're getting him out into the field to see some of the things. And he's been a great asset so far. He's been doing great, appreciating the quality of work and, the type of work that we do, and really been working well with our different operators and engineers in the county to help move the county forward.
Wonderful addition to the health department. We are very thrilled to have him. Comes with a wealth of experience and knowledge, and is originally local to Chautauqua County, and really kind of representing the North County area. So we do love, that kind of county-wide approach in our staffing. And we're just, really glad to have his expertise.
Did we not acknowledge the death of Paul Snyder? Our previous?
We will,
Okay.
but certainly if you would say
Yeah,
something.
Paul joined us after Steve Johnson retired, and Paul was a young, engineer, funny guy. And then he was with us for a few years and then left to go to BPU and
for a hot minute, and then
passed away last week
Yes.
at 47.
Yes. What is very interesting, and I was going to talk about that as part of so it's a wonderful transition, is that what's sort of neat is that Ron actually knew Paul as well. So it's this really neat kind of transitional aspect. And I never had the pleasure of meeting Paul myself, but shared with Jessica and some of her team that I feel like I knew him in a lot of ways because he's been talked about so widely. And as I've come in like, oh yeah, we did this with Paul. And so now I find myself saying like, oh, this is probably when Paul was here, right? So certainly stories were shared and thoughts throughout the day and that week. Very unexpected, and was also reached out to from people who have retired from the county about it. Just, their work with him and kind of the other engineering roles throughout the county. Yes.
Welcome.
Welcome. Thank you.
Okay,
Do you want
you're
to
on,
just go?
you're on,
Okay.
all right,
The
we'll
docket
continue to go.
here.
So everybody, of course, knows me here, Lacey Wilson, Public Health Director. I often like to open up and reiterating at the top of the report, the purpose of the Board of Health. I think that's important to be reminded of, especially as we have people come and join us for privilege of the floor. That really the purpose of the Board of Health is empowered by the New York State Public Health Law to formulate, promulgate, and adopt public rules, regulations, orders, and directions for the security of life and health in the county. In particularly important this year and significant this year, you will and have already, but will continue to be privy to press releases and different information around a 60th anniversary of the health department this year and the 100th anniversary of really kind of the first public health professional hired at the county. So Sherry Rader, who you all know very well, who typically, had participated with the group, she put together a great series of information that just highlights so much of the important work that we're doing today, how long-standing that work is, and how the models, the infrastructure, the approaches that have been developed over 100 years have gotten us to a point where we are today. Of course, public health work never ends. It just changes. And we find ourselves in those changing moments and the dynamic shifts of epidemics and water quality and everything in between, chronic disease included. So it's a very wonderful milestone, and we're very proud to be able to continue the service in the community. And you all are very much a part of that. So make sure you read those press releases, and there's some good information about the Board of Health, and also perhaps some information about one of the most, well, the longest standing commissioner in the county as well. There might be some vignette highlights about that person.
Tonight, I wonder if we want to do that.
Even more so important to document the very reputable history of Dr. Falk and Dr. Falk and Dr. Burke in Chautauqua County. So the other thing I just wanted to highlight quickly before I get into kind of the bread and butter of everything, the ethics training and financial disclosures. So those are coming up with a deadline of April 30th. I did share prior to the meeting that if you do have questions about, information and how to fill those out, the best way to help get the answers is to contact Hannah right now, and we'll do the groundwork for you and trying to get the information that you might need to fill those out. If you didn't at the beginning of the meeting, Hannah did have a sheet that she was sending around for you to acknowledge that you did at least receive those trainings. So if you wouldn't mind doing that. To highlight, really, this is more so Jessica's, area in the environmental health space. So I had told her to speak up and add anything to this section. But for the lead rental registry that you all have heard very much so about over the last year, we did procure a space in downtown Jamestown. That space has been completed, and the staff that has been hired has moved in there. At this point, things are working very well. A great location, collaboration in the city of Jamestown there. All budgeted staff have either been hired or are in process of being hired. So that's wonderful news. And New York State DOH, and Jessica, correct me if I'm wrong, last we heard was November 2025 is the goal month for launching the platform. However, we have not had any experience in the platform ourselves because we're not quite sure they actually have one yet, but they are supposed to by November. Have we heard any?
So yeah, the software system, the platform, it's supposed to come before November,
Okay.
at least to be available to us to start using it and figuring out how to use it, because actual inspections are supposed to start in late 2025. So we're looking forward to the platform. We at Chautauqua County, as well as all of the other counties in the state who are included in this program, have given the state lots of wish list items for what we want out of the platform. The platform will be open to the public, so landlords can use the platform, and then open to us so that we can monitor the platform, and potentially open to like local code enforcement officials and other folks who may be interested in the type of lead hazard data that's in that platform. But a lot of this is still just what we've been told, so we're looking forward very much to seeing it.
To just close out on that subject, by no means are we waiting on DOH there's so much planning that's happening along with the city of Jamestown to ensure that their registry program is going to align very seamlessly with the state's registry program, so that we can reduce redundancies and duplications, but ensure that perhaps we can share information and actually streamline and be more efficient in inspections and that sort of thing. So we are not wasting any time with this, kind of waiting period with the state.
Is that the one model after Monroe County?
Yes.
So
You study Monroe counties?
well, so the platform, so we've been given a lot of guidance. The rules and regulations have just exited the public comment phase. So those are just getting finalized for what, we've had a lot of webinars, a lot of interaction with the state as they've been working towards getting these rules in, cemented in. But yeah, we don't have the actual regulations. We're actually planning next meeting to give you guys a little bit more information with some actual slides and some more details about what this lead rental registry is going to look like and how we're planning to implement it. And then, potentially even discuss how we're executing the inspections and what sort of fee schedule we may need to consider to execute these inspections efficiently.
Who's the software vendor?
Who's what?
Who's the software vendor?
I would love to be able to tell you.
Yeah, state hasn't decided. To your point though, Marty, the overall feeling and sense is that the state really will model basically after Monroe County, just ensuring that it's a model that fits both the urban and rural networks that, are the multiple counties that are included in this. So it should be, and Anna, who runs, most of the programming, has such a handle on it too. We could probably draft our own, our own process and procedure program and get it going. But since the funding's coming from the state, we'll comply with, with the state.
Well,
The
in the
reason
state,
I ask is very simple. We wrote the state immunization registry.
Yeah.
And then they introduced our partner, which was IBM, and that was the end of it. It was just a nightmare.
Yeah.
And if
Yeah.
Monroe has a and they're being allowed to be a major partner, and that's sometimes the rate limit.
Oh.
That
We appreciate being the first in things for that very reason.
so
You typically get.
Yeah.
I will say, like, Monroe it's a model,
Yeah.
but the folks in Monroe County have reservations about what New York State has set up.
As I implied.
Right.
Yeah.
So, right, and the good thing I will say about the state implementing the lead rental registry program is they presented each county with 3 different models of how to implement it. And so we were able to choose the model that we anticipate working best for our county. So, yeah.
Some flexibility in bureaucracy.
Yeah, the environmental side of DOH tends to be more that way than the others. Moving on quickly too, because I know that this is a very much a topic of conversation nationally in regards to federal funding and federal grants. Just so you all are aware, at this point, there is no interruption. There are no holds in any of our funding or our grants at this point. Of course, we're watching, myself in particular, watching very closely in terms of, next year's budgets and things at the state and federal level. So it will be a year-to-year watch of how these things unravel. But at this point, there's no interruptions in any of our services.
Year to year, month to month.
So we're being hopeful. I'm actually going to come back to this middle section on infectious disease control, just so that if there are questions or thoughts, we can flesh that out a bit more. If you don't mind, I'll hop down to just to make you aware that our 2024 state aid reimbursement annual submission was made. So that is basically every kind of human services agency with a preemptive authority at the state. You're required to provide these submissions. It's your financial compliance documents, basically. And an auditor, and in addition to the state, reviews all of this information and the application that you provide. And I did want to highlight, on behalf of our staff, the great work that is being done. And the auditor in particular noted a really great marked improvement in our grant acquisition, because that really is part of the strategic planning that we've put in place to diversify our revenue streams so that we aren't, completely reliant on local tax dollars or state tax dollars or even federal. So that's kind of been a priority topic area of mine, to ensure that we can fill gaps in services. As you know, when you procure a particular type of funding, it comes with a particular set of boundaries and regulations. So if we can, fill in gaps with other funding, not only does it broaden the scope and quality of the services that we provide, but it also obviously improves sustainability and ensures that, we aren't left holding the bag, essentially. Okay. I will also go down to the updates here really quickly. Pediatric dental services, wanted to keep you all very closely updated with this. I did meet with the leadership of the Western New York Public Health Alliance, and they agreed and were in favor of pursuing a regional or multi-county support model for dental services should we need to. And they felt very strongly that there were some really opportunistic potential collaborations with the federally qualified health clinics in regards to dental reimbursement rates that they're able to provide. And so the other directors in some of our neighboring counties are going to sort of take that discussion on with their federally qualified health clinics. And I've been doing the same with our FQHC in kind of fleshing out what those details might look like and how a collaboration would work, and how we could support one another kind of through building a potential model there. I did attend a follow-up call with Dr. Arajo, the Dean of the University of Buffalo School of Dental Medicine. This was actually hosted by somebody at the University of Buffalo who's in like their outreach affairs office and had contacted me. There has still not been a formal notification of, ending funding, but it is becoming more clear during these calls and information from other directors in the region that the funding through the University of Buffalo will no longer be available to us.
So Lacey, I've seen the dental van parked behind Green School.
Yes.
So is it operational?
It's operational now until the end of this academic school year.
Okay.
I was actually going to tell you that you might be aware that Fidelis has picked up the tab for funding the dental van.
Oh. No, I was not made aware of that.
So Fidelis had programs in Utica and Central New York,
Yes.
which they have been funding dental programs for several years, going back to pre-COVID.
Yeah.
So we had a call, and I'm sure other pediatric practices may have, about a week or two ago, and said, hey, we have decided to pick up the tab for keeping the dental van functional.
Surprise. I'm so glad.
Need to know.
Which is great.
I'm so glad to hear this.
I
Yeah.
was floored. I'm like, okay, so where do you think we should be putting them? I said, well, we should collaborate with the Department of
Yes.
Health and other folks that are working on it.
Thank
I don't
you.
know if you have gotten a call.
I haven't yet.
Okay.
Okay, so specifically right now in the central, so were they confirming that they were willing to continue in the areas that they had been?
Yes. And
Okay.
I have the contact name
Yeah,
and an
that'd be great.
email that came, so I'll forward it
I
to you.
That would be
I
wonderful.
was delighted, but at the same time, I said, there are people that are working on it locally and spending time and
Yes.
energy. So you should be contacting them.
Yeah.
They would only look like pediatric practices in the area,
Good. Okay.
so.
You know, we had that representative from Fidelis at that one meeting.
Yes.
Early
I
on. I
bet.
wonder if it's that same person.
Probably.
Yeah.
All right.
You guys made a good impression.
So that's what I say. I did not mean to look disappointed by any means. I'm so thrilled to hear that. That's wonderful. And yes, and it's never a bad thing. Connecting, I got to
Actually shown
pieces
that
to-
you and everybody else is working with them first. Yeah.
This is why we meet for these, in these ways, right here. That is wonderful news.
I'll forward that.
That would be wonderful. Thank you.
I know at the symposium, they had a new representative who was in charge of grants with Fidelis, and she was going around everywhere trying to get everybody aware of some behavioral health $20,000 grants that she was pretty much selling as.
Yes,
you know, just. we'll give it to
selling
you.
her wares. Yeah.
Yeah, and it just seems like they're really active right now.
Yeah. Okay. Well, I mean, the other thing I will highlight, I guess I shouldn't just completely bypass that area. One of the things of note, as we were having these discussions, one of the things that we talked about is, especially if there were going to be reimbursement rates through Medicaid that could, cover the actual dental care and costs of the providers, that there would still be definitely a need for and a desire for additional grant funding to support. Basically, one of the things that they had talked about is it's difficult to get the students down from UB to us, especially during the winter months. And so a couple of the directors and I got together and I said, well, what if some of the grant funds were used to provide, some temporary housing for these students to come down through, which would help in many other areas of workforce development, not just in dental, but across the board, and provide experiences in perhaps correctional health, facilities, and federally qualified health clinics, and practices, private practices as well. So there are still opportunities there that we'll most likely pursue to just help bridge and bolster the workforce development around this and dental in particular. So it's not by any means in vain that we've had these discussions. Moving on to, on the back of this page, just some strategic planning updates. I like to keep you also aware of these things. Our staffing, so we did have 2 retirements and a 3rd retirement here in April. We're always very sad, of course, to see people go, but I do love the aspect that people are retiring with us.
Mm-hmm.
They're staying here, and really, these are seasoned professionals. We are working really diligently within our department and collaborating with HR to do what we can to really create kind of sustenance planning. Oh my gosh, I just forgot.
Subsistence.
Not
Oh, you're
subsistence.
thinking of
Sustainability.
sustainability.
Yeah.
No, you're
Succession planning.
Succession.
Like a succession. There are so
I'm
many
doing
S words in public health work, apparently. Yeah, so succession planning, we are working on, because we do have so many seasoned individuals in the health department, that we really want to capture their knowledge and make sure that's passed on, because that is invaluable. State trainings are wonderful, but what one state, mandate looks like in one county looks completely different in the next county. So the people with that county knowledge, we really want to keep, keep in the department. We have 10 vacancies currently. That's down from 17 in January, and that also includes the hiring of the lead rental registry staff that we've brought on board. Programming, strategic planning programming that we're looking forward to, and starting to plan now, of course, for 2026 and the rest of 2025, the sanitary code updates that we've been talking a lot about. And specifically, I wanted to highlight with, as we were talking about tobacco enforcement programs, but not just tobacco, substance use in general, the prevention of substance use. One of the things that we could look at that really could mitigate this issue of, transferring, operator licenses from here and there is, some regulation around overall licensing in general, setting a cap on a licensing amount in their county. So there are things that we can, provide information to you about for discussion. And perhaps I think we've noted before, once we move closer to that point, a committee that may want to meet and kind of hash these things out. Those are some potential ways that have been very successful in other realms of public health. And it's also what's unique about those types of strategies is it protects the businesses who are doing business well and who are doing business lawfully. And it really helps to mitigate the bad actors, in the landscape. So we want to make that clear, as we always do, specifically around these things, that we are here to support good business in our community. And in particular, we have a vested interest in promoting good, healthy business in our county. And good, healthy businesses provide the best returns as well. So overall substance use prevention work we're going to be working on. There are some exciting things on the horizon in partnership and collaboration with the district attorney's office. So we'll love to present a little bit more about that to you and have some of the district attorney staff come over and talk a bit more about what we're going to do there. There already has been some use of the opioid settlement funds. These are specifically through mental hygiene as the LGU for our county, but Steve Kilburn in our office coordinated project to expand upon, just as I was referring to earlier, funding that already goes out in terms of prevention around substance use in schools, evidence-based curriculum. This kind of fills a gap that some of that curriculum, really didn't cover. So it's that nice kind of hacking on of those layers and filling those gaps that we're able to use that for. So he'll continue to work on some strategies and programming around substance use prevention. Hepatitis C screening, treatment, and improvements are something, down the road, Dr. Falk, it would be wonderful too. They're doing a lot of wonderful things in the jail right now and improving their screening and kind of the efficiency of treatment around that. That has a particular tie to substance use. And Chautauqua County has historically been a county that has higher rates of hepatitis C. So this is something now with the use of, different technologies and again, kind of our involvement in correctional health, we have a really great opportunity to make some improvements in this area. And lastly, but certainly not least, in terms of programming, kind of priorities for 2026 will be maternal, infant, and child health. Not only just because of the landscape of what we always do and always promote in public health around immunizations and controlling infectious disease, but in particular around labor, delivery, and kind of that early, the early newborn kind of development of the children in our county. These programs and some of these initiatives will be tied specifically to substance use prevention. And others that we're looking at and some of the things that we're thinking about are geared more toward the systems and institutional levels and working with now what is our only labor and delivery hospital in the county, UPMC, to ensure that they are very equipped and have the technical assistance they need to promote healthy deliveries in our county and access as well. Any questions about that section before we move on?
Can I just mention one thing
Yes.
as it relates to substance use prevention? There's a new New York State Department of Health program called BUP app. Have you
Yes.
guys been made aware of that?
Yeah, I've
It's
heard.
BUPE-AP,
Yeah.
buprenorphine assistance program for people who are uninsured or underinsured to get free access to buprenorphine.
So yes, we will check into that too a bit more. I just came across that as we were preparing, actually, legislator Proctor invited us to do an update review at Human Services Committee last night. And as we were prepping for that, I came across that and was thinking potential opportunities of how we might be able to tie that into some programs that we already offer.
We're lucky in New York State that we have such good Medicaid coverage, so there's
Right.
not that many folks that would need it, but we can enroll them at TCC and they can take a card to any pharmacy and get free
Nice.
buprenorphine if they have a prescriber. They have to be like in with somebody somewhere.
Reviewing buprenorphine for Marty.
Oh, buprenorphine, yeah, it's for opioid use disorder treatment.
Excellent. Excellent.
I think that'll. I think that'll complement well with the program that New York Matters has. Because they will actually provide a voucher for the initial kind of bridge script from the time of the call to that first appointment. So this is something that kind of adds on to that.
And we could look at special populations that we serve.
But you know, out in the world of private practice, the access to buprenorphine is excellent. The insurers it's really fairly inexpensive if it's insured, you know. It's just the ones who are uninsured.
Yeah.
It's wickedly expensive, but everybody else can get it, and it's no hassle. And now I don't even think you have to go through the 7-hour training.
Mm.
You know, providers can just write scripts. And so it's a marvelous drug. Wow.
Wonderful. Quickly, just to highlight before we hop back to the front page again, some funding updates. So the infrastructure grant that does originate at the federal level and flows down through the state. We have submitted our year 3 application there, and that would be that includes funding to staff that were included in our 2025 budget. So we are eager to hear back from the state, and hopefully that's accepted so that we can bring those people on, and they would be primarily responsible for growing out those programming opportunities that I just spoke of. So back over to the front page to kind of talk about infectious disease control. So this is, again, kind of referencing 100 years ago when the first public health nurse was brought on staff. Timely or not, measles is part of that history, and bringing, nurses on to provide immunization, vaccine access to young children throughout communities in New York State. And we continue to do that work today. We are funded to do this work from both, federal funds and state funds as well. And not only do we do that work from our community health side of our department with the nurses, we do have actually one of our full-time nurses completely is responsible for that program. I actually love to mention her name. Her name's Teresa Miller. She's wonderful. She is very dedicated, a wealth of knowledge, but a number of the nurses in the department are trained in the immunization, all of the protocols, the timelines, the whole 9 yards. So during privilege of the floor tonight, actually, when it was mentioned, that it's a great idea to provide technical assistance and outreach to our providers, we do that regularly through Teresa. Teresa works literally hand in hand with the school nurses as well. The school nurses should officially on the record also be given a shout out. They do amazing work to ensure that our students are immunized based on the schedules, the mandated schedules, and also our partners at TCC do a wonderful job. Paul, I can't think of Paul's last name. Paul Robbins, also just an amazing partner in ensuring this. The really people that have a passion for this type of work. We are really blessed, honestly, to use that word. Because we do have this great consortium and network of providers and people that all know each other. So daily, Teresa is getting calls from school nurses. This needs to be corrected in NISIS for this student. So that is happening on a daily basis. So I do want to assure you all of that. And for those of you who are not familiar, NISIS stands for the New York State Immunization Information System. And providers do have access to that system as well. Not only on the infectious disease control side of things do we have a hand in this, but also through the environmental side of things as well. There is a public health emergency preparedness division, and they are responsible for really the systematic approach to how you provide access and emergency service during things like outbreaks and emergencies. So they're taking care of kind of all of the strategic partner planning around something like if there were a measles outbreak and we needed to set up kind of an isolated pod of, somewhere, they would manage all of those relationships, all of that communication with our emergency services personnel, talking with our providers, our hospital networks to ensure that everybody's informed. So they're kind of that information network as well. We do provide clinics, not only here in our brick and mortar clinic, but we do pop-up clinics all throughout the county, specifically in Clymer. And even more so now with the mobile health unit. We have a very robust, actually, better than what I've seen in other neighboring counties that, in my past work, a relationship with our Amish community. Again, Teresa has really forged that. She has an inventory of all of the Amish schools and works hand in hand with them. We have seen quite an increase actually just in building that rapport and that trusted relationship with Amish mothers choosing to have their children immunized. So we're actually very proud of that. In regards to the state rates and how we do compare, we are at 83.7%, higher than the state average of 81.2%. So that's, quite a feat to manage in a lot of ways, because we are a very there's lots of different belief systems and different groups within the county that typically do not, are not pro-vaccine in a lot of ways. So again, I think this speaks to the providers in our county, our school nurses, our staff for really forging relationships and providing solid, trusted information to the people of our county.
But Lacey,
Yeah.
not to gild the lily here, but that's a disaster right now waiting to happen at 83%. You're just looking for an outbreak. That is too low. And as great as it is, greater than the New York State average, it is still, you're going to have a problem unless you increase that rate to over 90%. And we know that from an epidemiological study show that once you get below 80, 89, you're just, all you're waiting for is someone to step off a plane. So,
Well,
that's
and
all it takes.
to your point with that too, in particular, there's a very particular set of circumstances that we find ourselves in right now that's very unique in regards to just a number of different kind of infrastructure, issues.
Well, you're being very politically
Being very
correct.
diplomatic.
You have a guy at the head of the whole thing who is a measles denier. That's the problem. And you have people who've just been waiting for this in order to justify what they think is their right not to vaccinate their children. That's our problem.
But a counter argument to that is, and coming from a pediatrician.
Yeah.
We have the access, but what do you do with the folks who just will
Refuse.
not?
I know. You're right in describing what you've got set up here. You are ready, willing, and able to vaccinate 100% of the kids, and you have the ability to do it. We just are looking at numbers that are scary.
So when Teresa goes out,
Yeah.
does these mobile van clinics, does that get entered in NICES?
It does. People can deny entry into NICES.
So like the Amish population, but
Yeah.
you could still monitor
So
numbers?
we can monitor numbers on our own, and that is why it is so important that we have this relationship through
Yes.
Teresa with these communities. So while this number is not reflective of the entire community, it doesn't mean that it's necessarily skewed in the direction. There may be more. There may be populations now that have never been vaccinated at the rates that we're seeing now. So while yes, our goal always is 100%. Understanding that we may be in better shape with this particular populations that would be very vulnerable to outbreak. We may be in better shape with them now than we would have been even 5 years ago. So that is some of the silver lining there, but it is in no way, an admission of perfection. And so that is why we have been working on, and Dr. Falk and I have been in on some emails recently where we're ensuring that the staff is particularly reaching out to those vulnerable communities
Or with
during this time.
two measles deaths, the fear should drive increased immunization.
We use the example all the time of polio and, the pictures of the moms holding those babies in lines, in front of the schools because they had seen what had happened, to the neighbors and to the friends. So you hate for that to be the scenario. But what we are trying to do now is amp up and be ready. Again, the public health emergency preparedness wing that we have is also fairly new. So our ability to respond and react more quickly and efficiently, I'm confident that is much improved since, 5-10 years ago or something like this. The other thing I just wanted to know around this is that we do have federal funding around this. So again, this is something that I'm planning for and really looking at. So the IAP, we refer to it as IAP, it's the Immunization Action Plan. That's specific funding from the federal government that goes to these points exactly. It's about the outreach, providing training, providing, relationship-based access to good information to try to raise rates of vaccination. 50% of that funding does come from federal dollars to us. So we're being thoughtful and planning for this as well. Being in New York State, there will certainly be a push to, if that funding did, become jeopardized, they would certainly prioritize this in state funding. Our vaccines for children, the FC program, that also originates at the federal level, but it flows through the state first. And that is basically what purchases the vaccine that we use to provide. So the other thing just to make note of for you is New York State DOH, along with the governor, they did launch a web portal for this. There have been 3 confirmed cases of measles in New York State, but downstate. We stay in close contact on a weekly basis through specifically infectious disease calls, but also amongst committees through the state association as well in a number of different realms. So there's probably 4 or 5 calls about all of these topic areas on a weekly basis. So should something start to occur or any diagnoses or confirmations closer to the region, we will hear immediately, and action plans are initiated well before anything, kind of blows up at that point.
Lacey, you have been very proactive with all of us. We have sent, the department has sent out letters to all the practices in the county. I think all of us physicians by now, seeing measles back in the news again, have kind of brushed up on signs and symptoms, but we've been a little bit proactive in getting that word out. But, the concern is, and this is the message of the community, it's not a matter of if measles is going to hit Chautauqua County. It will. It's getting closer and closer. The bigger, more populated states are getting hit first. Maybe some of the states that are traditionally less vaccinated or under vaccinated are getting hit first. But within the last couple of weeks, at least one additional case outside of New York City. So it's just a matter of time. And none of us, I have 5 kids, right? And none of us like to see our kids sick. Measles is, and I don't have to tell most of you at this table, but since this is a public meeting, measles is one of the most contagious communicable diseases known. And it can have significant adverse effects on children. And it can kill. And, as a physician myself, I place a lot of reliance on the American Academy of Pediatrics, who we know the strong stance they take with childhood immunizations. And, as a parent myself, I wouldn't think twice about getting my child immunized, getting the MMR vaccine. And I think that, what we ought to encourage our families who are kind of on the fence, right? I think there's a lot of people who are on the fence that just haven't made the decision to get their child immunized. No professional is going to say immunize for everything, right? There are some things that are higher priority, and I think MMR is one of those higher priorities. And I think that our advice to families should be, hey, if you're on the fence, find yourself a trusted physician or provider to talk to about the risks and benefits of each vaccine. Most of them are appropriate. Some of them may not be, given the situation of the family and the child, but measles is not something we want to have to deal with. Working with our corner program, I do not want to have to show up at a family and tell them that their child has died, or console a family whose child has died of measles. I don't want to have to do that when it's completely preventable. And we always weigh the risks and the benefits in medicine. And there's no doubt in my mind, as a parent and as a physician, that the benefit of the MMR far exceeds the risk. And it's not to acknowledge that there are no risks. And I don't think any of us are saying there are no risks, but the benefit far exceeds that. And I think that's the sort of the message that myself, as in the role I play in the health department and as a physician in the community and as a parent, that's the message that I would give to my friends if they're asking.
Just to emphasize that even more, is when you're standing at the bedside with a child with one of these diseases, you are so helpless. There is nothing you can do.
Yeah.
Right? Absolutely.
Well, it's not only the death, it's also the risk of lifelong encephalopathy, where these kids are just basically not brain dead, but they're very, very damaged. 1 in 1,000 die, and then a certain percentage also end up with permanent intellectual disability. For a falsified report on autism, which then Julie McCarthy ran with because her child has autism. And this has been disproven, and now they want to go back and look again. 100 million children vaccinated and no risk of autism shown here, but they want to go back and study it again. And the boogeyman is out there, and the internet is, people go down the rabbit hole. And the other problem you face, and you're right, it's our job it's hours of sitting and talking with people about something that really we know, as you said, is this really safe vaccine that has shown its efficacy. It's a marvelous vaccine. And you're spending like all of this time trying to convince someone who's done their research by going down the rabbit hole that they all can get to right away and find whatever they want down there. It's brutal and time consuming. And then the worry is they're going to bring an unvaccinated child who's got measles into your office, and you've got a waiting room in this, and you've got staff and everybody else is now at risk. That's the problem.
I have a little different take, tougher take, someone who grew up with these diseases. And there are some things as a society we can compromise and should compromise, and there should be discussion. Public health, kids' health, there should be no discussion. When the science has studied, there should be no compromise. There should be no exceptions. And there are certain things in life. We follow the traffic rules. We stop at a red light. We pay our April is right around the corner. But we're talking about kids' health. So this negotiation, sitting across like we are negotiating a loan or a mortgage, it shouldn't be like this. And we have, as a society, allowed it to get to this point that we are having these discussions.
I just wanted to put a plug in for adults, because there is a lot of questions and concerns of adults out there too about measles. Am I immune? I'm not sure when I was vaccinated. I was born straight. So and I'll probably go home tonight and have 25 questions in my patient portal inbox about that tonight. So it's helpful if the health department can put out a little bit of information for adults too, because there's a significant concern, especially those who have autoimmune illnesses, live with people who are sick, wanting to make sure they're protecting the people around.
Especially your patients who have had only one dose.
That's right.
That age group.
Yes.
And there's a lot of funny dates, like if you were born before this date, this. If you were born before these dates, you probably got one vaccine. If it's very tricky, so.
And in particular, point very well taken, and we will surely, do that, because we do have in our county in particular, so many grandparents as caregivers for young children as well. So just that tie-in, I think, would definitely
And there's
Yeah.
good data out there that if they've had 2 MMR doses, they can
They're good.
consider themselves immune. And I think that puts a lot of those grandparents at rest, even if they can't dig back and find their vaccine
Right.
records, they're sure they had them
Right,
done and stuff,
right.
so.
I'm a grandparent that's going to Texas to see my 3 grandchildren.
Yeah,
West
so you're gonna
Texas.
have some of these conversations, you know?
We're there every other month.
Maybe even on the plane, you'll be having some of these conversations. Well, what I in particular appreciate so much about being, with this group is not only just the wealth of knowledge, but truly that you are very respected leaders in our community. And as we see from, our standpoint with, Teresa, who goes out and we see the returns of that. As Dr. Falk was saying, that effective messaging of, I absolutely have my children, get this vaccination. That is worth so much in our community with all of you speaking these things as well. So we'll certainly do, continue to do what we can in regards to messaging and support to all of you. And yes, if you would continue to have these conversations in the community as well and bring that kind of personal tone to it, I think that is so important to approve, so many of these rates. And I still joke to this day, my grandpa is about to be 100 years old in September. And, I would talk to him about nutrition things and all that, as a dietitian, and he didn't care to hear anything about it. But I laugh at them all the time. I was like, if his doctor told him to dress like a clown and get in his car and drive down the road backward, he would have done it because his doctor told him. You all hold such a, high regard in the
Yeah,
eyes
but
of the
Lacey, I
community.
think since the COVID, you know,
Maybe not so much.
they all, it was the problem with it was, it wasn't just a flu outbreak. Because flu outbreaks we've had for years. And,
Yeah,
with 20, 30,000 deaths a year. This was a novel virus
Yeah.
that we were all learning about. People got actually killed in hospital, treated improperly,
Right,
not
right.
because these people were doing it, except they were trying everything they
Right.
could. And everybody learned, and it was the same thing with the vaccines.
yes.
It took some time to figure out how, and it created a tremendous distrust of all of us giving information about, because it kept changing. And it got politicized, then it got this, and then it really made it much more difficult to have a conversation about vaccines. And it's really too bad.
To Lacey's point, at UPMC, when the vaccine came out, December 2020, January 2021, the physicians that got in line first. And they actually had a 95% vaccination rate. The holdouts for maternal health and, for things that we didn't know at the time.
Right.
But I was really impressed. I mean,
Yes.
and it was like, I want what that person's getting,
Right.
if they think it's good enough
Right.
for
for
them, then
them.
we're gonna get it.
Exactly, exactly. And I think, what we found specifically through COVID too is there's so much access to information. And it's not necessarily good information,
Right.
it's just information. And we are seeing this is a very, well-documented thing. There is purposefully, misinformation spread
Oh, sure.
in particularly about vaccination, because it is a potential vulnerability on behalf of a nation. So, that kind of bioterroristic approach to misinformation and spreading misinformation online and the access there is a real thing. And so we do need to, again, kind of leverage the relationships that you all have, the real people in combating,
What do
some
you
of that.
think if there, people around this table are part of public service announcements with regard? You don't have to talk about all the vaccinations, but
Right,
if we
yeah.
want to really zero in
Little
on,
snippets and tidbits of.
That's a great
well,
idea.
or into just MMR. Like
Yes.
just talk about MMR because that's in the news.
Yes.
And then when they get in, you can have more
Yeah.
conversations. But if
That's-
every one of you,
How do you do that?
how do you
Well,
do
I
that?
actually have some really great ideas of how we could do that. And anybody who might be willing to be a part of a message like that.
Yeah, we had a couple of people. Same
But that's
thing.
not hard to-
Same
that's
thing.
not hard to do. That's not hard
Yeah,
to
no,
do
well-
these days. You can
Yeah,
people
well,
up.
On the telephone.
The one thing that you just brought up about going to Texas. Well, you realize people go other places as well. And their kids go other places when they grow up and they're unvaccinated
Yeah.
and they don't realize the risk that they've put that child, because that child's unvaccinated
I know.
and is going off to a game park in Tanzania or somewhere else. Or as it happened to a young man that I played football with in college, his parents were of a certain sect, he wasn't vaccinated. He went away that summer to South America to do missionary work, came back on crutches because he had polio, because he was unvaccinated. A young guy, 21 years old, beautiful blonde guy, physically fit, football. You know, he was just on crutches the rest of his life. And this is what you're looking at, some of these parents not realizing. Now, with the travel people do these days, they're going places where some of these diseases still exist.
Yeah.
And that's another gift, you know, that you give your child. One of those that the gift that keeps on giving the rest of their life.
Okay, we have our first PSA message right there, and Dr. Burke headlining that.
Well, I mean,
No, really,
it's
those,
a
I think
great-
that's a great
hey,
idea. Yeah.
If you want to do non-specific messaging, meaning don't want to put faces because it's too close for comfort, AAP in their Chicago headquarters have specific department that crafts and has crafted messaging around this,
Right.
and it could be a public service announcement.
Yeah.
There's usually a nationally known pediatrician like Paul Offit or
Okay.
someone, and they are talking, and it's already ready to go.
Wonderful.
As somebody who almost was taken out by measles, I am very passionate about this, and I probably lost 20 friends after the COVID debacle over the whole vaccination issue, but I
Yeah.
had to really fight for my life at 4 years old.
Yeah, I have a friend who had it
Yes, that's enough.
7 to 10.
It's also shocking.
And she was at the time 13 and a competitive swimmer going on to it. And I mean, that was it. She had to learn to walk again. You know, 107. That,
Of course, my parents did all the wrong things, ice baths,
right.
you know,
Anyway.
but hey, I lived.
Do I understand that Cat County is 10% lower in their vaccination status than we are? So I think they're about 73, 74%. So right
Most,
next door.
well, I was gonna say, most other, like, when we do like comparative counties across the state, most others comparative to Chautauqua County are in the 70s. So we're well more surrounded by
counties.
I know.
Well, I think your point is valid, though, that there's also a lot of folks who are like, oh, I have the option to not have my data shared
Yes.
in the system.
Yeah.
No
We
sharing
are
of data,
we're
please.
in a very conservative county in that sense, and that is a very real thing that people do not like to share, specifically their medical records and medical information with the government. So we do attribute a certain amount of percentage there not represented in this cost. I
I
know.
just want to say one thing, because this is not about vaccines, but it's the same exact conversation about fluoride treatment
Yes.
in teeth.
Oh,
Same
yeah.
exact conversation. And I mean, you can die from a dental abscess. Fluoride can shield your teeth and help prevent dental caries. So it's the same conversation. As soon as you hear the option that you don't have to have it, man, we battle it every day. And it's,
Is it a money thing?
No, it's the same
no, because
misinformation.
It's a Google
It's
thing. It's a Dr. Oz thing,
Okay.
you know, it's just,
The toxic metal misinformation.
yeah. And I mean,
Become
and the same people will
controversial
be
when
like,
it
why do
never
my teeth
was.
get so many, I was born like this, I get cavities. We should do fluoride. Oh, I will never have that. Oh, man.
Hey,
Yeah, it's the same conversation, the same.
It's.
Yeah.
But yeah, man, it is such a miss.
And especially in our area where the majority of people are on wells and
Exactly.
there's no fluoridation available.
Exactly.
Yeah.
Lacey, can I ask a question? You mentioned that there's 3 confirmed cases downstate. You're monitoring that. You monitor Pennsylvania and Ohio, and they're a lot closer.
Yeah.
England's a lot closer to us than New York City.
So there are national monitoring associations that the state associations and the state health department are in. So that's basically our affiliations with the CDC. So all of that information comes through there. Again, there are some worries in regards to, is the CDC going to be allowed to provide this information moving forward and that type of thing. The state has committed to basically say that they will continue to utilize the channels through which CDC gets their information at a state level, should that occur. But in conjunction with that, we just as a county, and county leadership, like through the county executive, is actually very close, with a number of the neighboring counties, both Ohio and Pennsylvania. And he will reach out to us multiple times. I've received a call about this happening in this county in this state. So there are some informal ways that we actually stay, closely in touch with those
Get a
counties.
lot of stop visitors and-
Oh, absolutely.
Yeah.
Oh, absolutely.
Pittsburgh and-
Yes,
Yeah.
we're talking about it in particular, again, with kind of, the planning I'm doing, around Amish outreach and communication. This is the time of year where Amish celebrations and weddings start to occur. And so you will have families traveling from Ohio into Chautauqua County and back and forth. Yeah, so, yeah,
I mean,
there,
I think Warren County is probably a lot more conservative than Chautauqua.
right, right. So you can imagine the conversations that we have around planning in all of these. all of these things. Really quick, I did just want to highlight also, because this is something kind of in the national dialogue, tuberculosis as well. I'm sure you've heard, about outbreak information in Kansas City. So New York State Department of Health, facilitates epidemiological surveillance around this as well. And it is part of our infectious disease control program. So there are nurses who are also dedicated to the local provision of services, what we are required to do in the locality once a positive case is identified. We are notified, and our nurses and Dr. Falk actually really move forward through the treatment and the local surveillance follow-up. And one of the things to also note, because this is coming up in a lot of dialogue and discussions, is the difference, of course, between active and latent. So I have got some questions in the community around, and actually Dr. Falk and I were just talking about this too, because with my grandpa as well. But typically what will happen, like in Kansas City right now, when there is what is considered an active outbreak, at the discretion of kind of the epidemiological oversight, they may recommend that even latent cases be provided treatment. That is not the typical. It's typically that outbreak that kind of ensues, that triggers that. So just in case you all are getting questions in the community about that as well, because we will get notifications of even latent cases. And at this point, we are not asked to or required to provide, treatment.
Do you know, Lacey, there used to be a TV clinic downstairs in this building
Yes,
where the Board of Elections is. There was an X-ray machine. And
yes,
we had a pulmonologist come from Erie once a month, maybe to
Yeah.
review, to look at all our cases
Yeah.
and shot X-rays down there. Yeah, that was,
yeah.
yeah.
So that Sherry references that in one of the articles. So these are little Easter eggs you have to
So
look for.
does the county health department then provide the treatment for patients if there were, you prescribe it? You're not reaching out to community doctors to prescribe it for the patients?
I mean, I can if you want me to.
No. I am
You have
very
it
happy to
fine.
have the Department of Health sit over.
You have at
Yeah,
times if
I
they're
mean,
working.
Yeah, so, yeah, thankfully, we haven't had a lot of patients that we've had to treat. But when we do, when we're presented with a case, if it seems straightforward, if there are other comorbidities where I may not feel comfortable, I'll refer to infectious. Typically, it's something that.
I just find it really different how the testing protocol has changed in the last 2 or 3 years, where they don't care. You can test it or just a verbal screening.
Yeah, I
Sorry,
think
what
it
you
depends on the hospital, I think, and
Yeah.
whether or not some hospital, I believe, still will require.
Yeah, as a Roswell
an annual
employee,
test,
they
but-
I thought
changed
DOH has requirements for that, no? It did.
We changed it.
They
Our-
realized-
Well, and DOH has it in particular the state has it in particular for their state facilities and operations. So operations like OPWDD, all of their direct service care providers still do have to go through the TB testing process and things. So, yeah, so.
I've been away from it for 3 years.
That changed about 2 or 3 years ago.
Okay.
when I worked in Africa, we had trained our out in these outposts. We trained our nurses, if someone came in coughing, like, take a sputum sample and just put it on a slide, heat treat it and just leave it. And then we had visiting nurses who were doing immunization. They would collect them, and I had a fellow who was trained at the London School of Tropical Medicine, a Cameroonian guy, and he would do the acid fast stains on it, and we were finding TB all over the place, and we didn't really think it. You never thought about it, and he got really good at it until he went fishing somewhere. And they found his head somewhere.
Oh,
It's not good. But anyway, I'm just saying, it was
It's the
really.
first day of spring, Dr. Bird. We need a little hope around here.
Shall we
But
move on to the
it
agenda?
was amazing what you're able to do rather simply, you know, in those situations. Just heat it on the slide, leave it, and then just put it, they wrap it in something, leave it until it gets picked up. And then he would look at it, and then we would send back out, you know, strep and INH, and the nurses would give shot. Yeah, it was amazing. It was not that difficult. Now, of course, you have multi-drug resistant. Anyway, enough of the stories.
Enough of the story, enough of the stories. Okay, so Lacey's done. The next thing on the agenda is other. Does anyone have any other topics to bring to the table tonight?
Do we, as far as the privilege of the floor, do we need to like, do we have like an executive session to talk about a response? I have no idea what the protocol is.
So, actually, so we can call it really is at the discretion of what you all would like to do as board. If you would like to call an executive session to come up with a formal response amongst yourselves as a group, if it's something that you would like to assign to a committee member in particular,
I will say, I don't know that, at least per the bylaws, that we're obligated.
you're not.
To come up with a formal response. So, I mean, that's.
Or
up
can I
to-
say something?
that's
My
my
name
board.
came up very
Typically-
quickly. I wouldn't mind
These guys
having a
would
look
draft
because
something.
what he's referring to, the person who worked for me, hasn't worked for me for a few years. So this goes back a little way. I wouldn't mind having a look at this because when a letter comes for me to sign to ask a patient to find another doctor, it's been fully evaluated by other people. I'm just signing it. So I would like to look at this because it was pretty disturbing what he said, and he has the right to contact the Office of Professional Medical Conduct. He has other rights. And he has-
There, yeah, and I can say too that information has been provided
Yeah.
in regards to proper like ombudsman
Yeah, right. It
access.
seems a little odd that he had problems everywhere he went. Not that I'm not that I'm inferring that he didn't, but that seems very strange in the story. So I wouldn't mind personally, because he did mention my name 3 times, looking at it because I have no knowledge of it. So I'd like to look at it. And I'll come next meeting or I'll send you a little note saying what I found, just because I found it a little disturbing, to be honest. You know?
And do you guys, my remembrance of this, the last time we had a lot of privilege of the floor was during COVID, which still gives those of us who are there some
Yeah.
PTSD, reckoning back to those conversations. But typically, the staff would put together
and
a
consent.
response and send it back. Unless we had any specific guidance.
That
we
would be
wanted to
at your, yeah,
provide
that would be
them
at your
as the
discretion. That
board.
is an option.
I think the first one regarding the measles, she was more sharing the information. And it was a more like, hey, how can we collaborate it out? I don't think for that first one about measles, we have to respond.
This is a
Or
point of
just share what-
information. I remember that name, last 20 years.
Marsha?
Yeah. what was
Marsha.
it?
Oh, she was the director of nursing. She was director of nursing here for many years.
Okay.
Like she was really good. Nurse.
Yeah. Like infection control or
She was the director of nursing, of the whole.
for the health department.
Yeah. And she was an ex-nurse.
I think sharing with her everything you talked about
Yes.
what you're doing
Yes.
is,
Oh, I think. your
is in
report
really
did-
direct response to what, you guys are ahead of the curve on all that, and it's just nice to.
She had a very sincere concern, she well-researched, and to not acknowledge in any way would be, if nothing else, rude. And you do have a lot of insight and that you
Yeah.
could provide to her in terms of what the county is doing. So
We would
I
be
would-
happy to
I
do
would
that.
second that.
I'm not sure what you provide the second speaker, but the information you already gave him about where to.
We would be happy to, if you so choose, provide referral information to there are at the state level, because of course, you know, as the health department, we have no jurisdiction over medical practice, hospital networks, private providers. But there are access ombudsman's offices basically through the state. And we can certainly provide that information.
And for the complaining is the hospital, the state health department has I mean,
An
that-
extensive, yes,
oh,
they
that
have an
would
extensive
get
process.
investigated, for
Right.
Sure, because I'm not sure what kind of violation that is to turn someone away, but it's not a good one. It's not really
Right.
something that,
There are, yeah, and there are specific, yeah, the ombudsman's programs at the
Yeah.
state, they work hand in hand with the Joint Commission who would specifically be looking into matters like that. So we would be happy to, in both instances, send some of that follow-up information on the board's and the department's behalf, if that is good with all of you.
Was a time frame provided in his complaint? I mean,
He
anything
did say, I thought he did say it had been going on for back to 16 years ago.
Oh, well.
But we will have it recorded and that will be in the minutes for you. Yeah.
I
Yeah.
didn't think that Board of Health was.
No.
Venue.
Venue for that either. And I thought it was, there would be other avenues for him to do it, especially with, it's now, yeah, all this evidence. So, okay. But
We will
Sounds like
certainly
he's
do
been
that.
at it a
follow-up.
long time.
There's a reason why the Chautauqua County Health Department, not the Chautauqua County Department of Health. A big distinction.
hey.
There's a number that they were getting this morning too, that comes to.
Hmm.
Mentioned by them.
I just want to know if there is a police.
Walk out.
We used to have police presence here when it was cold,
Yeah.
didn't we?
Yeah.
We had police here, right?
Yeah.
Oh, we're concerned.
We don't need to start inviting our patients to come complain about those of us who sit around the table. There'll be a long line.
It
Okay.
certainly will not.
Are there any other topics for discussion? All right, we all have the future dates listed there. I think they're on our calendars already, I
Yes, it
believe.
is.
Okay.
Yep.
Can I have a motion to adjourn?
So.
Do we need a second? on
No
adjourning?
second.
No, you do not.
That's it.
I mean, you can, I just.
No. Thank
See you in May.
all.